I'm John McGillicuddy, and this is Glenn Kindt. We're talking today with Dr. Edgar Kahn, Emeritus Professor of Neurosurgery at the University of Michigan and one of the charter members of the Harvey Cushing Society. Dr. Kahn, as you know, the American Association of Neurologic Surgeons is celebrating its 50th anniversary this year. They've asked us to talk with and tape the observations of some of the charter members of the Harvey Cushing Society for their anniversary program. First question I'd have for you is how you ever got interested in neurosurgery and into neurosurgery in the first place.
Well, I graduated from medical school at the University of Michigan in 1924 and started my internship in general surgery in January of 1925. And on the ward, a student came to me for operation for a hernia. And he mentioned that he had a bleeding tendency and that his brother did, mild. And I asked him if he told the instructor that sent him in for operation that, and he said yes. So I thought, well, I don't need to report that. It's known. Maybe it doesn't amount to anything. Well, anyway, the operation was started in the afternoon, and the senior intern was doing the operation, and I noticed he bled more than usual, just from the incision. And it kept on, and he had to ligate the omentum, and it took about 3 hours before he was through. And an ordinary hernia with an amateur doesn't ever take more than an hour ordinarily. Well, he was taken back to the ward, and I told the nurse if his pulse went up, and he'd let me know. Well, it did. And I came, took a blood count, and I couldn't even get blood out of his finger, and I knew he was bleeding. I was terribly worried. And the two chief general surgeons were out of town, Dr. Collar and Dr. Cabot. So I called Dr. Peet, who was in charge of general surgery then, and he said, get the patient right to the operating room, and I'll be right there. So he opened this boy up with a midline incision, and I never saw so much blood in my life. And he ligated everything, and it was really a pretty desperate situation. We had not set up for intravenous. We never used intravenous solutions in those days. And when we did a transfusion, we had to call a professional donor, which he did. A professional donor was called, but they couldn't get the transfusion started for some time. Well, anyway, the boy, he got everything closed, and we went up the old operating room, and I hardly knew Dr. Peet, but people didn't like assisting in operations in neurosurgery at that time, which were not too many, because they took so long, and our equipment was so poor we couldn't see anything. The classification of the gliomas wasn't out at that time in 1925. There were just a few different types of tumor, pituitary, gliomas, that's what they were, gliomas, and what they called endotheliomas or meningiomas. But the residents didn't like to help, or the interns, because they sometimes took 8 hours in this old room. And so I said, Dr. Peet, if I can ever help you, call on me. So he started calling on me to help him, and the first thing I knew, why, my ambition to be a general surgeon was dampened, and I thought so much, Dr. Peet, I became his first resident in 1926. Then in 1926, the first meeting of the Society of Neurological Surgeons, not the first meeting, but the first meeting of the Society of Neurological Surgeons, which was the only neurosurgical service in the world, was in 1920. And there were only about 15 members at that time, and they were it. But they met in Ann Arbor in 26, and Dr. Cushing, just while I was scrubbing the Dr. Peet, came up and said, why are you going to neurosurgery? Well, I can't remember what I told him, but the honest truth was that I disliked very much elective operations because I worried so much on doing an appendix and that or a hernia. And I felt, well, you're losing so many of the neurosurgical patients with tumors, why whatever you get through is gravy, and they don't expect things of you like should you lose an appendix or have a hernia hemorrhage or something like that. But that was how I got into it.
What was neurosurgery like in those early days, and what did the training consist of to be a neurosurgeon?
Well, Dr. Peet was the first neurosurgeon in the state of Michigan. There wasn't a tremendous amount of material. We worked in the old frame and brick hospital, University Hospital. We had no suction. We had no Bovie. We stopped hemorrhage with muscle stamps and with silver clips. We never started intravenous. Transfusions were given, never more than 1 or 2 to any case, using a professional donor, and only about 2/3 of them were satisfactory at that. And there was no neurosurgical service really, because I was the first resident that Dr. Peet had. So I simply assisted him, and he was terribly good about assisting me at operations in the early days. And it was a rather discouraging field, and it took a great optimist, and that was Dr. Peet's long suit, was optimism.
What did you use for anesthesia, too, for your craniotomies?
We used open ether, and I really don't know just how. We didn't have the Bovie, but ether was what was used, occasionally nitrous oxide. We didn't use an intratracheal tube until maybe around 1938, and Dr. Peet didn't like the intratracheal tube after it came in 1938 because it could be put in so badly, the tube would get caught and that sort of thing, but once in a while when he was doing a cerebellar, I'd see that somebody sneaked an intratracheal tube in without his knowing it.
Did you usually start intravenous before the case or after? You talked about starting it during the case.
You see, when the patient went bad, say from shock from blood loss, I would get down under the sheets and try to get a needle in the collapsed veins. So we had a nurse who was great and had been with us such a long time, and she said to me one day, said, well, why don't you start intravenous before the actual operation is started, because you're getting down under the sheets and trying to get into a collapsed vein. So why don't you put it in? Before, I said, that's a wonderful idea. And actually, this may seem very strange to present-day neurosurgeons, but Dandy did not start intravenous fluids preoperatively until 1940, I'm told.
How did you know you were finished your training with Dr. Peet? Was there any, did he ever tell you?
I never did, because I was with him 25 years, and I was always next to him, except for 3 years away in the service, and there was no formal training. But in 1928, Dr. Cabot, who was the chief of surgery, and I was still on doing general surgery at that time, thought I should get some formal neurological training. Well, during the World War, he was in England, the First World War, he was in England, and his neurologist was Foster Kennedy, and he thought the world of Foster Kennedy. He told me a story about him. There was Dr. Cabot was the chief of a hospital in England, and a man was walking down the hall to the operating room, and Foster Kennedy said to Dr. Cabot, well, what is that? Well, Dr. Cabot said, this man's been shot in the brachial plexus, and he has a useless arm, and we're going to amputate it. And Foster Kennedy said to him, would you mind if I spent 15 minutes with that man? And Dr. Cabot said, no, of course not. He went in, took him into a room, and when he came out, the man was using his arm. It was hysterical paralysis, which was quite common in the First World War, but not nearly as common in the Second World War. So I went down to Foster Kennedy's service for 3 months, and it was a perfectly wonderful service. He was the kindest man, and he was such a cultured man. He wrote better than any other doctor that I personally knew, and he was the type of man that he knew so many people in literature, the theater, and that sort of thing. Later, when he became desperately ill, and I think it was in 1951, his service was at Bellevue, and he asked to be sent to his own service, ward service in Bellevue, and died there. So I really did get a lot out of Dr. Kennedy. Then I came back again with Dr. Peet.
Tell me about your relationship with the Harvey Cushing Society and how that got started, Dr. Kahn.
In the Society of Neurological Surgeons, which, as I mentioned before, was the first society in the world, had about 18 members or so. They were the old professors, including the chief men that formed it were Harvey Cushing, Charles Fraser of Philadelphia, Ernest Sachs, who was secretary, and it was a very closed group. And it was difficult for younger neurosurgeons to get in, extremely difficult. And 4 men got together in 1931, Eustace Sims, Glenn Sperling, Temple Fay, and Van Wagenen. And one of them was a member of the society. I can't remember which one it was, but they thought there ought to be a society for the younger neurosurgeons. But the older neurosurgeons thought that they didn't need another society, that one was really enough. And but on the other hand, some of the older men strongly favored it. Well, these 4 men got together, and they knew the original members of the first society, and they asked their number 1 man, that is the first assistant. And I being the first assistant, Dr. Peet, I was asked by these people to come to Boston in June 1932 for the first meeting of a new society. I'm not sure it was named the Harvey Cushing Society at that time, but as a matter of fact, this group came, and I can show you a picture of the group, who they were. They were not just neurosurgeons. There were 3 radiologists, neuropathologists, and 1 woman who was the neuropathologist, Louise Eisenhardt, who was such a very important key to the new society. And then John Fulton, who was a physiologist, and we all met there. And I can point out the various people if you think it's worth, if you can do it. This is Glenn Sperling, who was one of the kindest men that ever was in neurosurgery. And Eustace Sims was a very fine man. He was older than the rest. I will talk about him later. Temple Fay, and this is Eric Olberg, who was the chief became chief at Illinois, Bill German, who became chief at New Haven. This is Van Wagenen, who became the first president Frank Teachner, neurosurgeon at Kansas. This is Paul Busey, and he was one of the most interesting, active people I ever knew. We roomed together at the first meeting. At 5 o'clock in the morning, he got up and I said, "Where are you going?" He said, "I'm going down to Faneuil Hall to see him bring in the fish." And I thought, how remarkable that anybody would... Well, of course, he was from Iowa in the first place, but I think I can say that Paul Busey has probably done as much for neurosurgery as any single man. This is Frank Ingram, who was really the first real pediatrics, or great pediatrics neurosurgeon. Louise Eisenhart. This is John Fulton, who was, of course, as you know, a great physiologist and Cushing's biographer. And he became president of the second meeting of the Harvey Cushing Society, and he did a tremendous amount, and that's the way I looked in those days.
Was the membership in the Harvey Cushing Society limited just to neurosurgeons, Dr. Kahn?
No, there were radiologists, pathologists, a physiologist as well, which made it a more interesting group, really.
Who were some of those people?
I've mentioned them. I mean, John Fulton, for example, the physiologist. Merrill Sussman here, who was Cushing's, he was the first neuroradiologist, and he was Cushing's radiologist. He was a brilliant man. And of course, Louise Eisenhower, who was Cushing's pathologist.
What happened during that meeting in 1932, and how did that group get to be called the Harvey Cushing Society?
Out of the, I think, 21 people that were at the meeting, at least half of them had some association with Dr. Cushing. Either they were trained in neurosurgery, which only consisted of 1 year with him, or one was his pathologist, another neurologist. And so people thought it should be called the Cushing Society. And Paul Busey got up and said, "Well, I think if it was going to be called the Cushing Society, it ought to be called the Harvey Cushing Society." And that's how it got its name. I don't remember much that happened at that meeting. I don't believe we had papers or gave papers, but you got to know a small group like that, and they planned for the next meeting that was to be in Louisville.
What did Harvey Cushing think about this group starting like that?
He was very pleased about it, and I know Dr. Peet was very pleased that I was asked to join it, and I think it was an enthusiastic, excellent group of people, most all of whom became pretty darn good in their day.
Dr. Cushing attended the meetings, did he?
I don't believe he was in on the business meeting, but he certainly was in on the dinner and that sort of thing, and spoke. And then he operated, and we all went into the amphitheater to watch him operate, and I was surprised to see the ritual in which they draped, which is all new to me. I don't remember whether the head was completely shaved. I don't believe it was, but it might have been. And they put bichloride, towels soaked in bichloride all around the wound, or the scalp, that was to be incised. And then there was practically nothing said in there, contrary to what took place in our operating room here. And it was really a pretty serious business, as you can imagine.
Now, after that first meeting of the Harvey Cushing Society, were there any other meetings that you remember as being particularly outstanding?
Well, the second meeting was at Louisville, And it was during Prohibition days, and the real mint juleps were served at the Penn Dentist Club. I remember that. Then in Philadelphia, several years later, a meeting was held at Temple Fays, and it was a beautiful night, and really the grounds were beautiful, and there was a fountain with a whole bunch of fish in it. And in the morning, all the fish were dead, and it was found out that some of the people had poured their martinis into the fountain, and that's as much as I got out of it as I remember, but outstanding in my mind. But the most outstanding one by far was Dr. Cushing's 70th birthday party, which was I think the 7th meeting of the Harvey Cushing Society. I'm quite sure it was. It was in 1939. And that was the greatest affair I have ever been to, because men from all over the world, friends of Cushing's, came. There were personal messages to him from President Roosevelt, and wonderful talks. Louise Eisenhower was present that year, and Eustace Simonds was the Toastmaster. And when Dr. Cushing operated, he had a German who sort of ran the operating room, whose name was Adolf, and he ran it like a German sergeant. And he would put a mask over his face, walk into the room with a mask over his face, and mop Cushing's brow when he saw it was necessary. Well, in the middle of this banquet, in came Adolf, put a mask over his face, and mopped Dr. Cushing's brow, Dr. Cushing's great surprise. But there were things like that. It was really a perfectly wonderful thing, as you can imagine. It was on the grand scale, I would say.
You must have a lot of memories of the people that were involved in the Harvey Cushing Society in its early days. Are there any things about the personalities or people that strike you today as being significant and important that you remember well?
Well, I've mentioned Paul Busey, and Eustace Simonds was one of the finest people I ever knew. He was so kind to me personally when I came back from the service and went to Kennedy General Hospital in Memphis for 6 months after the war was over in Europe. And I hadn't done much civilian neurosurgery, and when I would have a difficult case, I would call Eustace, who was the busiest man in the world because he was practically the only one doing neurosurgery in Memphis during the war, and he'd just appear to give me his advice, and he operated for me on more than one occasion there. And I think Eustace Simonds probably did more neurosurgery and good neurosurgery than any other man I know, because, of course, he worked so long, and he worked very fast, too, but it was great to watch him operate. There are Glenn Sperling, who he had more friends, more close friends among the neurosurgeons than I think any other man. And during the Second World War, he was the chief consultant in neurosurgery in the ETO, and he always took the part of the younger man, and he took the part of the neurosurgeons, often contrary to the higher powers, and almost took a court-martial once for something he didn't think was right. But I just thought the world of Glenn, and he was brought up on Missouri farm, and yet he was the most aesthetic man, I would say, of all the neurosurgeons. He worked his way through medical school teaching cello. He played in the quartet, chamber quartet with the Louisville Symphony. He learned to paint when he had to retire because he was ill so much at the end, and he became an expert photographer.
This brings us up to near the time of the Second World War. Could you tell us some of your experiences during that period of time?
Yes. I went over in 1942 with the University of Michigan 298th General Hospital, and we came into Europe first at Cherbourg, not too long after D-Day, and occupied a hospital that had just been left by the Germans with the odor of the dead and all the plumbing ruined, and it was quite a job. It was like cleaning out the Aegean stables. But anyway, it got going, and very quickly, and we functioned, I think, well. And then I was transferred to Paris to open a neurosurgical center in the Lariboisière Hospital. And we of course, didn't have first-line casualties, though I'd had some experience with that at operating tent hospitals, but that was just an interlude. But anyway, patients would come in from other neurosurgeons on their way to the States, commonly, and we would change the dressings, and I got to know some of the neurosurgeons who were really not known to me. Often a patient would have a postcard, a self-addressed postcard, and I noticed that quite commonly the name Captain Donald Matson was on the card, and I was exceedingly impressed with his cases, how well they'd been handled. And finally I wrote to him and said, your cases are coming in very well, and I would be very interested in where you got your training. So he told me he was trained by Frank Ingram, who was a very good friend of mine, and I mentioned was one of the original members of the Harvey Cushing Society. I think that Donald Matson was an absolute phenomenon, as he proved later. He was the best organized man I think I ever knew, and he did a great deal for the Board of Neurosurgery, and also for neurosurgery in general, and children's neurosurgery in particular. There were several, one outstanding case that we did have that I can never forget. And we were in Bristol before we went to France with the 298 General Hospital, and one day our officer in charge of infectious disease, Harry Tousley, came to me and said he got a call from Bristol that they would like to get some penicillin from us because they had a child with meningitis. They had done a lumbar puncture and gotten pure pus, and they would like to have the use of some penicillin. Well, Harry told me about it, and I felt it could not be just plain meningitis. It had to be an epidural abscess. And so we went to our commanding officer, who was a regular Army colonel and a Texan, gruff but very fine man. And Harry said to him, the health officer, Harry used to go into the well baby clinic because he had time in his hand. There was so little infectious disease. Well, the colonel said, we cannot give out any penicillin. It's against the regulations. But is this child the son of a serviceman? Harry said, yes, the father's in India. Then he said, bring him out here. So the child, who was 5 years old, was brought out to us, and he was terribly sick, and a stiff neck, and I felt he did have meningitis. Undoubtedly, Harry repeated the puncture and got pus below, and I was sure he had an epidural abscess, but we did tap the ventricle and got a lot of cells in the ventricle. So we put some penicillin in the ventricle, and I then did a laminectomy where the pus was obtained, and at first, on removing the lamina, it looked perfectly normal, and I was a bit concerned, but I just moved the dura a bit, and out came a small gush of pus. So we drained it and closed very quickly. Then the child got the worst convulsions I have ever seen, and it was from the penicillin, which we did not know at that time would cause convulsions, until Earl Walker's book came out, I believe. But anyway, the child got well, and that was my all-time and Harry Towsley's triumph during the war. And it cemented our relationships with the British doctors, too.
Now, Dr. Kahn, later in 1954, you were president of the Harvey Cushing Society when it met in Santa Fe. Is there anything you can remember about those times or that meeting?
Well, all I can really remember was the business meeting. And I never could conduct a meeting. And I was supposed to have a parliamentarian or something, but he didn't show up. And they said it was the shortest business meeting that the Harvey Cushing Society ever held. So that's all I can remember really about it.
Dr. Kahn, I think it's safe to say that you knew everyone who was involved in the early beginnings of neurosurgery, most of the great names of that time. Are there any people who really remain stuck in your memory that you were really impressed by in the 1920s, 30s?
Very definitely. I got to know Percival Bailey, of course, through Dr. Peet. He came over. He was a great admirer of Dr. Peet's, and vice versa. I feel that Bailey knew more about neurosurgery because of his wonderful knowledge of anatomy, his knowledge of pathology, which practically nobody else had at that time, even his knowledge of psychiatry, and he was a good neurosurgeon besides. But he really said he did neurosurgery to see the pathology. But he came over in 1928 with Bovie to see Dr. Peet, and went over slides with him. And I can remember so well how he would look at a slide and said, I think it's so-and-so. And Bovie would say, look at it and say, no, he said, I think it's so-and-so. And I was terribly impressed that a younger man would be speaking up quite like that. But then Percival Bailey, he did some awfully nice things for me, I know. But about that time, he asked Dr. Peet and myself to come over to Chicago when Foerster was visiting. Foerster was a marvelous neurologist, and he was not a great technical surgeon because he had never really had technical training in general surgery. But he learned a great deal about human physiology or human neurophysiology in his operative cases. Dr. Peet and Adson and I visited him in Breslau in 1931 when we went to the first meeting of the International Neurological Society. We went to Breslau and saw him there, and he was the most gracious host. And then Dr. Peet and I went up on a trip with the firsters into the mountains. I remember so well. So later, I knew he had taken care of Lenin. That in 1922 he'd gone into Russia to look after Lenin. I knew when he went in there in a small airplane that tipped over and dislocated his shoulder. He had to see Lenin twice every day and report to the committee, the 6 men who were running Russia, that is Stalin, Trotsky, Ordzhonikidze, I don't remember the others. He had to report to them every single day. Lenin had very bad headaches. His problem was cerebral arteriosclerosis. Well, I happened to be in Russia a second time and saw Lenin's tomb. And I was very interested. It was so, the body looked as if it was alive almost. And I'd talked to Dr. Förster about him before, and I said, I knew Lenin was autopsied, and I said, well, was a coronal incision used in the autopsy? And he said, yes. He said, I autopsied him myself. Well, we talked more about it, and which I won't go into, but he stayed in Russia for a long time, and finally he was allowed to go back to Breslau.
You've mentioned to us in the past, Dr. Kahn, how impressed you were with Clovis Van Sant. Can you tell us a little bit about him?
Yes. Clovis Van Sant was a great neurologist, and during the First World War, he was actually a great hero. He was a neurologist. De Martel was a neurosurgeon, and there was a breakthrough at Verdun, and Van Sant tore off his Red Cross brassard, whatever you call it, and he stopped the breakthrough at Verdun, leading the men, and I don't know how many Germans he is alleged to have killed, and there's a monument to him at that area. Well, he came to watch Cushing. He decided to do neurosurgery himself, and he had 2 assistants, Marcel David and Puech, and they came to visit Percival Bailey. They'd known Bailey at Cushing's and knew how much Bailey knew about neurosurgery, and Bailey suggested that he visit Max Peet. He said, you should go and see Max Peet. And he later said to me, you know, people think that nothing's ever been done in neurosurgery west of the Hudson. I thought I'd show them. So I told them to go and see Max Peet. They spent 10 days here watching Max Peet operate. He could not speak a word of French, and Van Sant couldn't speak a word of English, but they got along fabulously. And it was really remarkable, and of course I was with them constantly, so that I knew them so well. And later I saw them in Paris and that sort of thing, and Dr. Peet went over to help Van Sant when he got his first Bovie in Paris. I'll never forget, Dr. Peet was a crack shot and was very proud of it, and Van Sant took him bird shooting, and a bird got up, and it was such a distance Dr. Peet didn't offer to shoot, and Van Sant brought the bird down, and from then on Van Sant could do no wrong. He'd had his match in shooting. Well, when I came to Paris, just after Paris had fallen, or after Paris had been taken by the Americans, I went to the hospital I was to work at, and was told I was to have a conference on a Russian officer with a French neurosurgeon. And who came but Clovis Van Sant? And you can imagine, after the years of privation he had been through, how glad he was to see an American that he knew pretty well. And during the war, Van Sant had in his clinic, after Paris had fallen to the Germans, politicians, Jews, who were in his hospital beds with bandages on their heads. And he told me that occasionally his men had made an incision in the scalp, but he never did it himself, he said. Well, when the Germans came in, they said, "We know you're a great professor, and we would like to come and to your clinics." And Vincent said, "You're the conquerors now, and I have a clinic every Wednesday at such and such a time." So the German officers came, and the first case was brought in, a woman, age 70, shot through the head on the retreat from Paris to Bordeaux. And he had a very careful, beautiful neurological examination. Then, second case, a child, 7 years old, shot through the spine with complete paralysis on the retreat from Bordeaux. The Germans got up and walked out and never came back again. That was the way Vincent did things. And when I had been in Paris for 7 months, they decided to move my center to the Pitié Hospital, where Vincent had his clinic. And I hated the thought of going. It was very close to the end of the war. We had a good team, and Glenn did his best to prevent it, but there was nothing he could do. They wanted the neurosurgery in the Pitié Hospital, which was the biggest hospital in Paris. So I had to occupy Vincent's own clinic, and I was so embarrassed, and I went to him and explained there was just nothing I could do about it. But I used to sneak around from my place to his place with gloves, some old gloves, and suture material, needles, and he understood perfectly. But you can see why I admired Clovis Vincent.
Now, you also traveled to Queen Square and met some of the people there. Is there any things you remember about those things?
The two people, I was there for some months in about 1935, and the two people that impressed me most, and from whom I think I learned the most, were Arnold Carmichael and Sir Charles Symonds. And I learned more about teaching from Arnold Carmichael than I'd ever learned, I think, before or since. He was a very down-to-earth man with a wonderful sense of humor, and he wasn't nearly as serious as the other people. And I think he was criticized, perhaps, for that. But I got so much from him. Then, in the clinics I attended, Charles Symonds was the best neurologist that I have ever seen. And he was a great neurologist because he knew not only neurology, he knew a lot about neurosurgery, and he was a trained psychiatrist as well. He's a very quiet, dignified man. And I later met him at Oxford during the war.
We've talked a bit about a number of the early greats of neurosurgery, but one person you always felt was one of the very greatest in neurosurgery was Max Peet. You worked with him for, from 1925 to his death in 1949. Would you perhaps share some insights about Dr. Peet with us?
I would like to first mention people that I felt were remarkable technically for certain operations. And Max Peet was famous for the operation of tic douloureux by the temporal approach, which isn't done anymore. And one day there was a meeting of plastic surgeons, and Vilray Blair was the dean of the plastic surgeons at that time, and the meeting was in Ann Arbor, and they asked to see Dr. Peet do a tic. And Dr. Peet made his skin incision, and when he did, I was assisting him. Unknown to either of us, Vilray Blair snapped his stopwatch, and Dr. Peet had the centrifuge of the gas area and ganglion exposed in 7 minutes. So you can see why I felt he was a great technician, but I want to speak more about him. Then I think seeing Eustace Sims do a disc is, I thought, was a remarkable thing. Bronson Ray doing a hypophysectomy and Charlie Drake doing an acoustic tumor. And in mentioning Charlie Drake, the man who trained him, Kenneth Mackenzie, joined the Cushing Society in 1933, and he was president in 1936. And I think that Mackenzie was perhaps the most thoughtful man in neurosurgery. In a very quiet way, he was always trying to learn rather than telling you how to do things. But he trained Charlie Drake, and he had done very fine work in acoustic tumors. He had a method that changed the approach to acoustic tumors, that is Mackenzie. But he always, the first thing he did was cut across the porus acousticus, and naturally got the facial nerve. And when Charlie Drake left his service, he signed a photograph saying to Charlie Drake, who will save the facial nerve in doing an acoustic tumor.
Dr. Kahn, could you tell us again some more about Max Peet, about your early association and how it went with you over the years at the University of Michigan, and anything else that you might remember?
As I said, I was his first resident. And he was so good to me. He saw that I met all the, when we'd go to a meeting or anything, he'd see that I met the interesting people. And here he was training me. I could call him in the middle of the night. He'd come over and help me. I said, "You're just doing fine," and then get straightened out. And he was so good about it. And sometimes when a younger man gets to doing the big cases, the older man gets jealous. I've known that. He didn't know what jealousy was. He wasn't jealous of anybody because he felt he was just about as good as anybody technically in neurosurgery, and he didn't hide his light under a bushel, I guess you'd say. But he grew up in a small town outside of Ann Arbor. He went to high school in Ypsilanti. He became interested in ornithology very early. He stated that he had learned his technique, which he knew was tops, on skimming hummingbirds, day-old blackbirds, and day-old house wrens. And they say the preparations he made were second to none, and he attributes the facility he had in his hands to doing a technical job like that. Well, when I'd get in trouble, he knew I'd call for help. Sometimes he wouldn't come because the nurse I mentioned before would say, "He's just doing fine." But one day I was doing a tick, and I was in trouble. And I told the nurse to get Dr. Peet right away. So she said, I can't reach him. So I was mad, and I said, "I suppose he's over at the museum working those goddamn sparrows," where he frequently was. And I got the thing done all right. 2 weeks later, the same thing happened. And I said, I was doing a left-sided tick, and the Durator and the Anesthesia, we had no control of increased intracranial pressure, and I was really worried. And I said, "Get Dr. Peet right away." And he came up in about 20 minutes, and I was holding, and I said, "Where were you?" He said, "Well, I was over at the museum working those goddamn sparrows." So he really just was a boy all his life. And he wrote one of the very first papers on the avian ecology, one of the first great papers when he was 23 years old. was in medical school. He studied the birds of the Ypsilanti Bayou for 6 years himself. Before that, there was a contest in ornithology for Michigan students. He asked if he could go into it. They said yes. He went into it, won first prize, which is a beautiful Audubon print. But he had, he admitted he was as well known internationally for ornithology as he was for neurosurgery. But he was just more fun to be with, and when we'd go to meetings, he was so interesting in talking of biology and that sort of thing that the men they're always around him.
What was it like to operate with Dr. Peet? Was he a serious operator? You mentioned how Cushing was such a stern operator.
He joked a lot when things were going well, and which is not done in most neurosurgical operating rooms. There wasn't much talking at all, and he had taken a trip for 3 months, about 1932 or so, with Van Tyne, our professor of ornithology, to shoot the white-throated swift for the museum. He said that was the fastest flying bird there was. And we were talking during the operation. I said, he said, I said, how many did you shoot? Oh, he mentioned, a certain number. And he says, sometimes the bird flies so fast you can't see it. And I said, did you shoot any of those? And that's the only time I ever stopped him in my life. But he was so much fun to be with, but he could get mad when things weren't going right. And the one time he'd come home for lunch, no matter what time it was, and Mrs. Peet always knew if something had gone bad, particularly with a child. If he'd had a bad time with a child, she knew it. But otherwise, he'd come in and he'd lose a case of malignant tumor or something, and it really simply, he wouldn't let it bother him. That was all there was to it. He knew it was hopeless.
What are some of the last things you remember about Dr. Peet?
Well, in March of 1949, I was in a town about 60 miles away, giving a talk at 10 o'clock in the morning. I was just starting when I got a telephone call from Phil Gordy, one of Dr. Peet's senior residents, who had started a case for Dr. Peet. He told me Dr. Peet was lecturing to the students at 8 o'clock, and toward the end of his lecture, he appeared very pale and very sweaty. He finished the lecture, walked up the operating room, where Phil was opening a case which had been sent by another neurosurgeon. It was a very difficult case for diagnosis, and Dr. Peet was getting ready to explore the angle. He said to Gordy, I'm going down to the heart station. He went down to the heart station, and that's all I knew. I didn't know, just that he was going to the heart station. I immediately got in my car and came back because I knew it would be a difficult, the case wouldn't have been sent by another neurosurgeon, and so I drove as fast as I could, and I came into my office, and the superintendent of the hospital was there and said, you no longer have a chief. And Mrs. Peet was there, and it was really pretty awful, and I had to go to the operating room and explore the area. And it's very hard to remember just what went through, but this I know, that I simply didn't, there actually was not a lesion there, as was proven afterwards. It was an exploratory procedure, and it turned out to be something else. But it was an awful experience for me because I'd been with him these years, and even though I ran my own service, I could always go to him for advice, and then he would literally take the responsibility if he gave the advice. So it was an awful blow to me, I can assure you.
It must have been a great privilege to work with Max Peet.
It was. As Howard Knapsker said there's only one Max Peet.
Well, thank you, Dr. Kahn, for sharing your experiences with us about the early days in neurosurgery.
Thank you, Dr. Kahn.
Thank you.